Breakfast and brilliant ideas, coffee and conversation, we're serving up that and much more at IBJ Media's events. Join us at an upcoming event and kickstart your day with fresh ideas and new connections. Check out our event lineup and register now at ibj.com/RSVP.
Your circumstances don't necessarily have to define you. There is a path and there is a way for you to be able to continue to reach your goals, even though sometimes there's some stumbling blocks in the way.
That was Dr. DaWana Stubbs, Regional Vice President and Chief Medical Officer of Humana, talking about her inspiring story of ascending to healthcare leadership as an Indiana native. And this is IBJ's The Freedom Forum with Angela B. Freeman. Dr. Stubbs, I hope it's okay if I call you DaWana.
Absolutely.
It is such a pleasure to have you here and have an opportunity to get to know you better. I'm super pleased to welcome you to the Freedom Forum. You simply have an impressive story that I'm excited to share and learn more about. However, before we get started, will you please tell our listeners a bit about you, your educational and professional background, and any other factors that have led to you becoming the Regional Vice President and Chief Medical Officer of Humana?
Well, first, let me just say thank you for inviting me to your podcast. This is truly an honor. I am a West Side native of Indianapolis, Indiana, proud graduate and product of Indianapolis Public Schools. I graduated from the Crispus Attucks High School, 1984 valedictorian.
Nice.
From there, I went to Indiana University where I received my undergraduate degree in science education, and then went to IU Medical School to receive my doctorate degree in medicine. Also did my residency training through IU School of Medicine. Went back several years after that, after being in practice, got a master's degree in clinical research.
Wow.
And then after transitioning from 100% clinical work and seeing patients, where I transitioned into managed care and more an administrative role, went to Indiana Wesleyan, where I received my master's in business administration with a concentration in healthcare.
Wow. Super impressive. That's a whole lot. And I'm so excited to have you here and talk about that journey, right? Because that's a lot of milestones wrapped up in a short sentence, but it took a long way to get there. So you're clearly an Indiana girl. You mentioned you're a proud IPS graduate, an IU graduate, and you've received numerous degrees from all those Indiana universities. You mentioned your bachelor's, your master's, your medical doctorate from Indiana University. I want to know, what were your career goals at the time you decided to pursue all these degrees in science? Did you know you could be a medical doctor? Was that an aspiration you had at that time? Tell us about what motivated you to become as amazing as you've become.
Thank you. I'm going to say I knew that I wanted to be a physician, a medical doctor, probably since middle school.
Okay.
It didn't actually start out that way initially. My mom is a registered nurse and my father worked for IMPD for 30 some years before he retired. So initially, I want to be like my mom. I liked science. And so she was a nurse and I felt like that was a way for me to continue to use my interest in science and be a nurse. And I didn't want a job. That's crazy. When you're young, even then I realized I don't want to have a job where I do the same thing every day.
Right.
And science is always changing. It's always evolving. So I knew from that standpoint, this is where I wanted to go. I need this, I need this job in healthcare to be able to do that. And so since my mom was a nurse, you will be what you see.
Right.
And so I saw that. So it's like, hey, I'm going to be a nurse. Well, lo and behold, when I was in middle school, my father marries my stepmother, who is a Black female and was a physician. She was a pediatrician, Dr. Billy Jameson, here in Indianapolis for several years. And then I was like, oh, so women can be physicians. I had not seen that prior to that. In my upbringing and coming up, whenever you saw a physician, it was on TV and they were always male. And for the most part, they were always white. So I never really saw that until she came into my life and realized, hey, I can be that. And then the second thing was in my transitioning from being a nurse to a physician always was I figured out that nurses took the orders and physicians gave the orders.
Right.
I wanted to be the person really giving the orders.
Right. That's such an inspiring story. You said it, and we know it's to be so true. If you can see us, you can be us. It is about exposure. I talk about it all the time. The more people and kids in particular are exposed to things, it just broadens the horizon. You don't know that those kind of career paths exist until you see them. And like, oh, I can be that too. Okay, I want to do that.
Exactly.
And what does it take? Yes, absolutely. So we know, I mean, women and girls fall out of STEM so readily. You said you learned or knew in middle school you want to be a physician, but we know most girls fall out of STEM by middle school and certainly beyond high school, college, etc. So I want to know, again, you mentioned your stepmom who was a physician at the time. Your mom was a registered practitioner, so she was a nurse. You were surrounded by that. But what really made you stick with STEM, pursue it, particularly in what clearly is a very male-dominated field, even when you were young and still figuring out what it took to be a physician and get there?
I think for me, what really stuck for me, once again, was I didn't want a position or a job where I was going to be doing the same thing day in and day out.
Right.
And so when I think about science, I had a great middle school science teacher. Her name was Miss Maurice Abel. And I can remember sitting in her class and she was talking to the students. Most of us were brown students. And so one of my friends was like, he got a B on the test. And he was like really excited. And she was like, why are you excited that you got a B on a test when an A is better? And so from that point on, that was kind of like my mantra.
Right.
Like, why settle for less? And so, when you think about STEM and how challenging that is, I challenged myself because I wanted to be that best. I'm always striving for that A, if you so to speak. And so that is what really motivated me to stay in STEM. I call myself the perpetual learner. And because science, healthcare is always changing, there's always something new on the horizon, something to learn. That's what motivated me to continue down that path. The other part of why I'm still like in STEM, once again, very young age, my mother and stepfather divorced, separated. It was a very difficult time for my family at that point. Even though my mother was a nurse, you go from a 2-income house to a 1-income house.
Sure.
You have 4 children that you're trying to take care of. And so we, at that time, received government assistance. And we needed government assistance to get by. And I could just see the toll of that loss of that relationship from my mom, what that took on her.
Yeah.
And so in my mind, I'm thinking, okay, look, I got to be able to have a job where regardless of what happens in life, I'm going to be able to take care of me and mine.
Absolutely.
And so literally from that point on, my whole trajectory, my goals in life were getting to medical school and what did I need to do to be able to get there.
Absolutely. I can so resonate with that whole story, particularly around wanting to be excellent and not being scared or resistant or hesitant or diminished because you learn that being excellent may mean that you are one of few or one of the only. Okay, if that's what excellence looks like, then let me show that it looks like me too.
Absolutely. And a lot of times, when people tell me or would tell me something that I couldn't do that,
absolutely,
that made me want it even more. And a lot of times you get that, or I was getting that at least I felt that way, that I couldn't do it because of what I look like, because I was a woman, because I came from this single mother home, because I was a young African-American female,
Right.
that some things were just by default of my demographics and my characteristics, physical characteristics, that certain things were out of my reach. And I was like, well, I'm going to show you. No, I'm going to prove you wrong.
Absolutely.
And so that drive, made it even more for me to do it. I can remember as a freshman going into Crispus Attucks High School, and they had a program called Health Professions. And so I was like, yes, I want to be a doctor. I'm going to enroll in this class. I was so excited about it. And my friends were like, so you do know that class is either A or F. Like there's nothing in between. Like, why would you want to do that? People fail. That's not what we, you shouldn't do that. And once again, in my head, I was like, well, that's them.
Right.
That's not me.
That's right.
Let me show you what I'm going to be able to do. And so my whole 4 years in high school was wrapped up in this health professions program, and it was amazing. So I was learning medical terminology as a freshman in high school. I got to learn how to draw blood, insert catheters, things that people were paying for
Right.
to learn how to be able to do. And so through IPS, I got that as part of my education. It was free, and I enjoyed it. I loved it.
I'm so excited about that. And I think you are exactly right that it is so important. Is one of the reasons why I am in IP law, the exact same motivation. People said, well, it's very male dominated, not many diverse women at all. Okay, well, then let me do it.
Absolutely.
That's all the more reason why I need to be there.
Absolutely.
Yeah, absolutely. I'm excited about that because I think it's so necessary for people to not be belittled by the fact that there are still so many industries and fields and careers that there are just not a lot of diverse people. If that's your passion, that means that's all the more reason you need to be there to personify that is possible, to give someone else the opportunity to see it's possible. So thank you for that. And thank you for being so obstinate to pursue the dreams that you had set for yourself. I want to know about, okay, you've achieved being a medical doctor. You've been practicing. You've been in clinical. You're getting this experience. You're realizing your dream. And then you get to a point in your career where you also realize there are things even beyond this. I've reached my pinnacle. I did what I said I was going to do, but I can still use this experience to do something different. And in doing that, you earned your MBA. I want to know, in your career, what did you see getting an MBA would do for your career, particularly as a medical doctor? And what skills did you seek at that time that motivated you to go back to school after all those many years and residency to get some additional skills that you thought would be beneficial to you?
When I first started out in healthcare, in medicine, that was just my goal. Once again, you will be what you see. So my stepmother was a practicing pediatric physician, and she saw patients in her office. That's what she did. So she would see them in office. You would go to the hospital. So that's what medicine is. That's
Right.
what I'm supposed to do as a physician. I'm going to go out and see people. I'm going to take care of them in the hospital. And so when I initially started out in medicine, really that's all I knew. And that's all I was thinking I was going to do.
Right.
But then as you go through your career, and I got my MBA, later in life, now a lot of people come directly out of college and school and out of college, and they go directly into their master's program. That wasn't my trajectory. So I had practiced in clinical medicine for almost 20 some years. So I worked in a federally qualified hospital here on the West Side. I also worked in a private practice for one of the private hospital organizations and systems here in Indianapolis. And so during that time, I had been doing it for so long. I was like, well, what else is there, to do? How else can I, what I've learned, my expertise from being a physician, my clinical background. And I really had an interest in trying to move over into the administrative space. And so in working for the private hospital system here, I just raised my hand and was like, yes, I want to be on the committee that is looking at that time, it was in healthcare, you have these codes. So it's called your ICD codes, your diagnosis codes. And so I was on the committee looking at those codes as they were coming out and helping change and which ones would we adopt and which ones would we use. I also decided that I wanted to be on the peer review committee. So when there were issues or complaints about physicians within the system, I was like, okay, yep, that's me. I'll do that too. Whatever it was to kind of get into this administrative role. And then lo and behold, I was going through my emails and I saw this email that said medical director. And I was like, oh, what at that? And at the time, the health system was going through changes. And so I really thought this was going to be announcing like who the chief medical officer was over my department area. So I opened it up and nope, it was about a position and a health plan, healthcare organization needed to have a medical director and it was located right here in Indianapolis. I wouldn't have to relocate, uproot my family. I interviewed. I think I started the interview process like in October. Within a month, they had made the offer. And because of my contract with the health system, I had to stay for 90 days. And so after that 90 days, I guess you could say the rest is history. And so I moved into this new administrative role using my clinical background in a different way. And so instead of seeing patients up front, and I'm the one deciding on what their healthcare plan is and what should be done, as a medical director, I am the person that looks at those prior authorizations. So when your physician wants to send you to get an MRI, they want to send you to see a specialist or get a special kind of test. That was my job, to look at that, to make sure that it was medically necessary and that it was appropriate for your care. So I just got to use my medical knowledge in a different way. And as I was talking to my supervisor at the time, he actually made the suggestion. And I think because within about 6 months of being in this new role, I was one of the top performers in the organization. It was the nursing staff would also come to me and for consultation and ask questions. And so he was like, if you want to move up and you want to do different, if you want to be sitting in my seat, this is what you need to do. So he encouraged me to be able to go and get my MBA to move up. And I think the skill that I was really looking for was more the business acumen behind the medicine. Like I said, clinically, I knew what to do. You can't outperform me in that area. How to take care of patients, I was good at that. But how to combine that clinical knowledge with the business of medicine is the skills that I needed to acquire, and were able to do that by going back to get my MBA.
I so appreciate that ability to take a honed and expertise that you've gleaned and worked at over couple decades and pivot that into a different career path, a different ability that also works better for you at that time in life, right? Like you had done 20 years of being on the ground, seeing patients, front lines, doing all the work, and then got to a more senior position where you're like, okay, I've done that. Check that box. I've done that as good as I can do it. I want to utilize my expertise to influence in a different way, and basically moving into more of an administrative leadership role where you are learning the business. I like that, learning the business of medicine, because I appreciate that, going from being a scientist to a patent attorney and then becoming a partner in a law firm and learning the business of the law firm. Absolutely. Not just doing the law, but learning the business and how, if it doesn't make dollars, it doesn't make sense, like providing good patient care or good legal services, but within a corporate infrastructure that is still built to make money.
Oh, absolutely. And I've been in this, managed care organization on this administrative now for about 13 years. And I'm still learning, because I feel like this wasn't my base. This wasn't where I came from. Science is. And when I was in the MBA program, I was like, my brain does not work like this. Like, I am so focused on science and the data of
Right.
things. I said, so now you want me to figure out this spreadsheet and be able to balance this. I got to look at the budget. I was like, there was a reason I didn't take business classes in college. This was, science. I love it. I like being able to see the chemical reactions and, when you mix stuff together and then you get this new product. I like being able to dissect stuff. But you want me to what? I got to add it. I got to balance it. I don't know if I can do that. So it definitely was me moving out of my comfort zone to be able to do that.
Yeah. I want to ask you about the journey there. We've talked about the technical side and the learnings and the academics of it all, right? The academics and even the practicality. Now you're a physician, you're actually seeing patients, et cetera. But I want to know about your journey from a more holistic and authentic point of view, meaning I know that in your role, you've sat in many rooms where you're the only woman, only person of color, only woman of color, etc. Any person that looks like you. You mentioned when you were at IPS that, you were there with a bunch of brown students, right? And certainly I can imagine that your career has not been that. So I want to know, has there been any unique experiences in climbing this corporate ladder that you've described in one of the largest healthcare entities in our state and our country? And how have you navigated some obstacles that may have looked or seemed or felt at the time career limiting or barriers that you may have encountered as you've ascended the ladder to executive leadership in a healthcare organization?
I'm going to say there are two things that really helped me throughout my career, even from the time I was young in middle school through high school, through college, and definitely once I got to medical school. One was being truly rooted and grounded in my faith. I was raised both sides of my paternal and maternal family. Church is what we did. It was just like that was expected on Sunday morning. So regardless of what went on Saturday, you were getting up Sunday morning and going to church. And so I applaud and contribute that rooting and grounding in faith to both of my grandmothers. I said, I know people laugh about and they say they had a praying grandmother. Well, I had two. So that first and foremost, honestly, is my faith. There is a scripture, Philippians 4:6, that says, be anxious for nothing, but in everything by prayer and supplication, let your requests be known to the Lord. So during this time and throughout my life, I have come, as I've matured and got a little older, I've really come to understand what that scripture meant. And so I literally, I pray about everything. Mm-hmm. I don't care how small or how big, because I have come to learn that there's nothing too small or nothing too big that my God can't handle. So that's my first thing. Second thing is that I had a village, that I had parents, grandparents, aunts, and uncles that always poured into me and was, you can do whatever it is that you want to do. And they always supported me. One of the challenges, challenge, is that my second year in medical school, I found myself pregnant. And it's really funny because during your second year of medical school, you go through like all the body systems. And so cardiovascular, you go through your GI. And I would always have what I would call sympathy symptoms. So whatever system we were studying, that I would have those symptoms. We studying cardiovascular. Oh, I start having palpitations. We studying GI. My stomach was bothering me. Well, lo and behold, when we got to OBGYN, and they were describing these symptoms of what pregnancy looks like, I had those symptoms. But I was like, surely I'm not pregnant. That cannot be. Yes, it was. So at the end of my second year of medical school, I had my son. And so that was now a challenge. How am I going to navigate being this young mother, single mother for most of my son's childhood? How are we going to navigate that? And I can just say, thank the Lord for my village because they really came around me. And it was, my grandfather was like, I expect great things from you. So I'm not going to let my grandfather down. My mother, because I'm a product of a teenage mother. My mother was 16 when she had me. And so even she poured into me and was like, this does not define you.
Right.
You can continue to move through and do what you wanted to do. And I had to look at myself and figure out, well, the reason I became and went to medical school and said I wanted to be a doctor was so that I could take care of me and mine, whenever that situation arose and whatever happened. So here I am in this situation. I got to take care of me and mine.
Right.
So I'm saying that to say I was able to finish medical school even with my son because I would call granddaddy and be like, okay, I'm on rotation. I got to be at the hospital till 5:00. I need somebody to pick up my son. My grandfather would go pick him up.
Yeah.
My cousin and her husband really were my son's godparents, and they truly were his godparents. Because in medical school, especially on my surgery rotation, my son really lived with them because I would have to be at the hospital at 5 a.m. Sometimes I wouldn't leave till 11 a.m. when you're in medical school. And so they helped take care of him, sponsor him. So even when I had to leave him, he was being left with family that I could trust and knew that he was going to be okay. I actually set out a year of medical school. So I had him at the end of medical school, my second year. So how medical school works, your first 2 years are really kind of book work, academics, clinicals, coursework. And then your third and fourth year is when you enter into your clinicals. I set out a year because I did not want to leave my new infant at a daycare or with someone before he could speak. So I was like, I at least want him to be able to point, if something's going on, something's wrong. So I did sit out for a year. And because I was in good standing at the time with the medical school, there wasn't a problem when I went to the dean and said, hey, this is the situation. This is what's going on. This is what I need to be able to do. So, and during that year, I was able to work still so I can stay in clinic and stay around healthcare and still learn. I worked in my stepmother's office. I received an externship down at St. Francis. It was on the south side. The old St. Francis was on south side in Beach Grove. And so I would work 2 or 3 times a week in the ER as an extern, as a medical extern. So being able to see patients, being able to learn from the ER physicians. And so then once again, because I had my village, I had someone taking care of my son when he was not with me. And so I'm saying all that to say that your circumstances don't necessarily have to define you. There is a path and there is a way for you to be able to continue to reach your goals, even though sometimes there's some stumbling blocks in the way.
Now it's time for a break.
Get caught up on the state's top business news every business day with the Inside Indiana Business Radio On Demand podcast. Available now at InsideIndianaBusiness.com, Apple Podcasts, Spotify, or wherever you get your podcasts.
We're back with Dr. DaWana Stubbs, Regional Vice President and Chief Medical Officer of Humana, on this 51st episode of the Freedom Forum with Angela B. Freeman. I need my audience to know Dr. Stubbs and I just met today, but there are so many synergies in your story. It is shocking to me. I so appreciate having the child 1 year in school, etc. I had my son before I went to law school. Part of the whole calculus of whether I could actually make that work was trying to figure out, okay, how do I make sure he's good? How do I make sure that I can do what I need to do in school? And unlike you, who had a familial village, we were here in Indianapolis with no family around us. So we figured out who our friends were, who our village was. And a lot of that came through them taking care of my son during law school. I mean, that's a real thing. And you are not the first or the last of my guests who've talked about going to school and pursuing some significantly terminal degrees, high degrees, by still trying to manage and navigate family life and all the challenges that brings. I think ultimately that just makes you even more of a well-organized professional, because you've already had to figure out how to manage time, how to make sure all the things happen even in your absence, how to make sure your child gets picked up when you're someplace else, how to make sure they're fed, they go to bed on time, they get to school, all the things while still doing what you need to do.
Absolutely. It's funny because several people that went to residency with me, they know my son, because there were some mornings we had to report to what's called morning report. And so you had to listen to the patients and, listen about the patients. There were education. We had mortality reviews. And so sometimes I was like, we running late. So you coming with mama today. So
right.
I need you to sit in the back of the room with me. And he would sit in the back of the room. He would have his little coloring book and crayon book. I said, so we going to go to morning report for this hour, and then I'm going to go take you to the daycare. So people still ask to this day, people that I work with and in resi, how's Myron doing?
Right.
How's your son? How is he? What's he doing now? And like I said, once again, they know him by name.
Oh, absolutely.
And so it is so, uncanny, because as you said, I just had to figure it out. I had to be able to do what I do. And I think part of that is what I call one of my strong suits is organization.
Mm-hmm.
And as you say, being able to figure out, this is the schedule. How are we going to hit this schedule and make it work? So I got to drop you off at this time. I got to pick you up at this time.
Right.
So in the middle of the day, I'm going to be doing X, Y, and Z. How am I going to, make this happen? Once again, I had him at the end of my second year of medical school. I still had 2 more years to go. So I still had studying and practice, that I had to do. So I am a very regimented person, much to my family's dismay. But I have to have it written down. I have to know what I'm doing, because that was my life. So biochem, we going to study this from 8 to 10, from 10 to 12, we studying this, from 12 to 1. Okay, lunch, I got a break. From 3 to 4, we need to do this. And I still follow that schedule, because if something's not on my calendar,
right,
it's not going to get done. I will miss it.
Absolutely. That's where I am now too, and it's real. But the point I would also make about that is, I've talked about this a lot, is those are some of those what people would consider soft skills, or skills that you glean and learn in not a professional setting, but it still aids in your ability to be an exceptional professional. I know so many lawyers who came the traditional path and came right into law firm practice, where you're keeping track of 6 minutes of time, who has never known how to do that or how to manage. I've got 3 meetings, I've got 2 projects that has to get done, et cetera, because they've never done it. If you've been a working parent, you know how to make things happen.
Absolutely.
You know how to schedule.
Absolutely, you do. Absolutely.
Those are some of the skills that I think when we're hiring young talent, we need to look for, because when someone says they're a working parent or they're managing a sick parent or whatever the case may be, that is a lot of extra skills that they can absolutely apply to their professional life. Speaking of your professional life, now that you've gone from being a clinician and being a clinical patient-facing doctor or physician to this administrative role, I'd like to know, what does your day-to-day job entail? What do you do every day? Like when you're at that point of basically running a hospital or helping run a hospital or a healthcare system, what does that look like for you?
So currently in my role, I oversee in the Indiana market here, Humana, one of the Medicaid programs from the state of Indiana. So underneath me, I have a quality department. I have our utilization management department, and utilization management, once again, is the team that determines the medical necessity of services that that are being requested. So whether that's from MRI, inpatient admission, you go into a nursing facility, or you receive in rehab, that's what utilization management takes care of. I also have my behavioral health team that is underneath me, as well as what's called population health. And so my day-to-day day life to some is probably boring because my kids think I don't do anything but sit in front of a computer all day. But it's really organizing those teams and managing what they do. So for the quality team, what we look at is, are our patients and members receiving the right care in the right time at the right place? And how do we as a organization do that? So we monitor, like the frequent falls of members. We look at the care that is being given to members that are in nursing homes, the care that is being given to them in acute care facilities and hospitals. We look at the timeliness of us deciding those decisions and getting back to the providers. Those are things that our quality team looks at. From utilization management standpoint, once again, we're looking at making sure that the services that are being requested by your physician are truly needed by you. And so we're looking at that. And so those things, once again, making sure that we are applying specific criteria appropriately for our population health team. They are the ones that are looking at those, as you say, kind of like soft skills, but we're looking at those things of social determinants of health. How do they affect our members? Making sure that we are providing our services in a culturally and linguistically appropriate space. So do we have interpreters for our patients that speak a different language than English? Are we truly meeting our members' needs? So how many of our members need help with transportation? Do they need help with food because they're living in a food desert, and how we can get those things to them? That is what our population health team does. So I am managing those teams to make sure that the organization in itself is providing quality care to the members that we have been charged to take care of.
Okay, that's super interesting. And certainly a view of healthcare and medicine that most people probably don't know. What I want to know next is, what do you think are particular strengths that you bring to your team? You've already talked about how you were able to organize and manage. Sounds like you're doing a lot of that, so I can appreciate that. But what are particular unique qualities or characteristics or skills that you possess that you really think have empowered you over your career and at this time in your career to be successful?
I think one of the things that let's say once again, my organizational skills, and being that single mother, having to be able to balance school life, home life, being a mother, being a full-time student, even when I went back to get my MBA. So I was working full-time. I was a mother of 3. I was a wife. And so once again, managing all those people together. And so as from a leader standpoint, being able to truly kind of see the whole picture of your team and what each member of that team needs. Because as a mom, I have 3 different children. They have 3 different personalities.
Right.
And at one point, because of the age difference in my children, like I said, I had my oldest when I was in medical school. And it's like, well, we don't want to do that again. So there's 10 years between my oldest and my second. And there's like 13 between the oldest and the youngest. So at one point I was laughing that I had children at all developmental stages. So I had one going into preschool, one going into elementary school, and one was like, in high school. So being able to have that sort of like emotional intelligence and being able to meet my staff and people that report to me where they are, being able to actually see them for who they are, being able to truly understand what their strengths, what their weaknesses are, and how can we build upon those. So let's not focus on necessarily what and I hate to say weaknesses, but your opportunities that you may have to be able to learn. Let's focus on what we know you do well. How can I help you do that better? And if you truly do have an opportunity that for education and you need to learn, I think being able to listen to them and figure out how can I get you to where I think you need to be or where you need to be a better performer. And not only that, not only where I think you need to be and really where I'm trying to get you to be, but where do you want to be?
Right.
What do you see as an area that you need to work on, and how can we do that? So I think just by being a mother and being in that situation, it's easier for me, I think, to be able to see the whole picture and be able to see the people that report to me for who they are. And then how can I help you get to where you really want to be?
Yeah, absolutely. I can certainly appreciate how those two skill sets work together to absolutely be benefit in the work life. So, and particularly in managing people, right? Which is what you're doing a lot with managing teams. I want to know, going back to being having diverse representation in medical and healthcare professions and leadership, why is that so important for patient success and better patient outcomes? We hear a lot about needing to have diverse professionals or diverse leadership in any leadership, but particularly in medicine. How does that potentially affect better patient outcomes or patient outcomes generally? We've heard a lot about infant mortality and maternal mortality and how all of those things are particularly high in diverse populations as compared to others. How does being a Dr. Stubbs in the medical field leadership really help improve patient outcomes and some of those stats?
Well, we know statistics show that when you have a healthcare provider that looks like you, that you tend to have better health outcomes. And I believe that's because you have some shared experiences. So when I worked in the federally qualified hospital, it was here on the west side of Indianapolis. A lot of my patients were people that I went to high school with, or they're related to someone, that I went to high school with, or they look like my grandmother. They look like, my grandfather. So I really had a vested interest in making sure that they received the appropriate health care. I really saw that as my calling. This is where I'm at because this is where the Lord wants me to be. And part of that comes from when I was in medical school. I won't say the hospital's name, but we would be in our classes, and a lot of times our professors or, our instructors would be the quote unquote ex-hospital patient. And I'm like, well, what does that mean? The ex-hospital patient? What are you talking about? And so I quickly learned that that was really code for the Black patient or the poor patient. That's really what you meant by saying the ex-hospital patient. So once again, I just kind of felt like this is where I need to be. This is my mission. I'm going to have it so that at least they can see and have one person that knows that looks like them and knows that I truly care about them, that you truly care about them, that I am taking the time to listen, to understand what they are saying. And I think that means that's the world to people, because when you come into your doctor's office, you're not coming to the doctor because you feel good.
Right.
You're coming because something is wrong, because you feel bad, and you need that person to truly see you and hear you to be able to understand and figure out, how can I help you?
Right.
And part of it is, it was so funny working in this federally qualified hospital. Before social determinants of health was a thing and a term, I've always had to deal with social determinants of health, because you will have generations, coming to me. There were families where I saw the mother, the grandmother, the daughter, the whole 3 generations of family, sometimes 4. And so when you think about this social determinants of health, when you have grandma that is now raising her grandchild for whatever reason,
right,
and you're on a limited income, it comes to, do I get my medication or do I feed my grandbaby?
Right.
And so you had to be able to work with them and say, hey, I understand. Yes, you have to feed your grandbaby, but I'm going to need you to take this medication and get your medication as well, because if you don't take care of yourself,
right,
then who's going to take care of grandbaby?
Right.
And so sometimes it had to come down to, we need to have some serious conversations, and how are we going to do this? And so I work for Wishart. It was Wishart, now Eskenazi, in one of their federally qualified clinics. And so they had what was called the Wishart Advantage program. And so as long as you lived in Marion County, you got subsidies and you helped, and they would, like insurance, like Wishart Insurance, to be able to help people pay for their medications. And so for me, it was not only what medication was going to be effective and treat that patient, but what medication is going to be affordable for this patient so that she can get her medications and still feed the grandbaby.
Right. I want to know, in those roles, because that sounds to me like you really using and utilizing your authenticity, your authentic self to really meet the patients where they are. I understand the challenges. I understand you're pressed to take care of yourself and feed the grandbaby, and you're not quite sure how it's all going to happen, right? I understand, because I was just talking to I remember having a conversation with my grandfather about the price of drugs, and particularly his at the time was one that I was very involved with, and him fussing about, Angela, how do you think somebody can pay for this, right?
Absolutely.
Like, how I'm getting, my Social Security and whatever. I'm trying to manage all these bills, and this drug is as much as my rent or whatever, my mortgage payment or whatever the case may be.
Exactly.
And really appreciating that that's a real thing for a whole lot of people that they are managing in order to also manage their health care as best they can.
Absolutely. Because a lot of times they would just say, well, their patient is not compliant. She's not compliant. And so for me as the physician, I had to kind of peel the onion back and be like, well, why is she not compliant? Yes, we know she's not getting her medication. We know she's not picking up. But what is the reason? So when you take the time out really to have those conversations, and I think it's easier sometimes for patients to have that conversation when the person looks like you and the person grew up in the same neighborhood area that you grew up in. Like I said, once again, because you tend to have those shared experiences, it's easier for you to be truthful, for you to just say it is what it is.
Right.
And so, and honestly, it made it easier for me, I think, to be able to ask those questions and the patient feel comfortable enough and trust me enough to answer truthfully and say, well, Dr. Stubbs, this is really what it is. I can't afford this because I got to do this.
Right.
And so then I'm looking like, okay, well, how can we have you do both? So whether that's we need to get you on Wishart Advantage, we need to have you talk to the social worker. What medication assistance programs can we put you in for you to be able to do what you need to do to take care of you and be able to take care of your family? So you can't just throw your hands up and say, oh, they the non-compliant patient and, wash your hands of them. No, my job here is to serve you, to help you. This is a partnership. Let's partner together to get you to the best outcome that we can.
Yeah. You can hear the passion in your voice, the passion that you've clearly given your patients over the years. You give your current administrative role now because you know that ultimately affects patients and affects patient outcomes. Ultimately, being a native of Indianapolis, growing up here, seeing how the healthcare system has moved and shifted over the course of 2 decades and more, I want to know, what are some of the greatest advances you've seen Indiana healthcare companies make with regard to equity, being more inclusive, either in the workplace culture and environment, or going back to what's most important, which is those healthcare and patient outcomes. And then what are 2 or 3 tips or tools that you would suggest to any Indiana healthcare leader to help continue making our healthcare systems, our hospitals more equitable? How can we better serve patients in Indiana and beyond?
I think one of the advances that I have seen through healthcare really is the acknowledgement of that term, social determinants of health, and how your address, unfortunately, determines your healthcare and determines your life expectancy. So someone that lives in, I'm going to say like our far east side, you may live like, I think it's 46218. zip code as opposed to someone who has the 450 zip code, which is, I think, like out in Carmel or somewhere, how their life expectancy and their health is simply based upon the area that they live in. And so I think that advancement that in healthcare in general, that we now acknowledge those things called the social determinants of health. And those things are where I live, where I work, my education level, how they affect my health care. And I think that is one of the biggest advances, that we are acknowledging that, knowing that that is important in how people, once again, manage their medicine, how they take their medicine, how they get their medicine, what type of food they have available. Because it's easy for you to sit down and tell a diabetic that you need to eat healthy.
Right.
But if I live in an area and the only source of food that I have is the 7-Eleven, there is nothing healthy in the 7-Eleven. And to be perfectly honest, it costs more to eat healthy, to buy fresh fruits from like that grocery store, than it does to not eat healthy. You know, it's cheaper sometimes for me to go get those Vienna sausage as opposed to going to buy me, you know, a 4-ounce salmon steak, or to go get me some, you know, give me some fresh fruit. And so once again, when people have to weigh those options and my money only goes so far,
that's right.
That's what I'm thinking about. So once again, I think the biggest thing in healthcare is that we are recognizing that as healthcare systems, as healthcare organizations, how those things affect our members, and more importantly, how those things affect their health.
Dr. Stubbs, I so thank you for being here today. I thank you for sharing your story, giving us more insight into all the different people and roles that really go to make our healthcare system work for us as best they can, and who recognize that our healthcare system is not working for everybody as well as it can, and trying to change that in all the different ways, from being actually patient-facing as a clinician all the way up to reviewing and recognizing whether what someone has prescribed to you actually is relevant and on purpose and necessary to advance your healthcare. I, for one, didn't know that was a thing. I thought when your doctor prescribes it, you get it, no harm, no foul. And it's good to know that there is some additional QC that's going on to make sure that what's happening on the ground is truly being done to advance and progress someone's health.
I think, and you said some of the tips and how we can really, truly look for that diversity. Healthcare organizations, healthcare systems, you have to be intentional about meeting the person where they are. We have to be intentional about understanding our membership and our patients. And I know one of the things like our Pop Health team does, that we do what's called a community needs assessment. And so what that is that we go out and have surveyed our members. We have surveyed other organizations, service organizations in that membership and around the state to be able to determine what that looks like. So where are the populations where we know that we have members that have a food desert? That's the sort of things that we're looking at. What areas are having more difficulty with transportation? Which areas do patients have issues with health access? How far do they have to drive before they can get to a hospital, before they can see their primary care physicians? So health systems and organizations have to be able to do the work, do that deep dive into the data and ask those questions, because we can't determine what somebody needs. And the only way for us to truly know, in my opinion, to know what somebody needs is we can't assume based upon our experiences and our lifetime and where our life and where we live, because that looks differently. We already know based upon your zip code. So you have to be able to do that work to get to know the people that you're serving and to be able to do that. And when you look at that, then that allows you to be able to see it from their lens, not your lens. Mm-hmm. You're sitting in their seat, not in this seat here looking down on them. And so being able to really do the work, collect that data, learn what your membership is, the people that you serve, where they live at, where they come from. And I think that's the big one thing to do is that you have to know, study. What does the data tell you to be able to determine how you can help someone? Secondly, we need to make sure that we have appropriate hiring practices. So in order to serve people and have that comfort and trust, you really do need to have people that look like them in positions. And so that's all the way from the call center to the CEO. So do we have people on our call, in our call center that can speak a language other than? And so if you're in an area and Spanish may be the language, well, then we need to have some bilingual call center folks that can speak both languages. I said, I know when I worked in a federally qualified hospital clinic, I actually took Spanish because we had interpreters, but that to me was so impersonal that I had to have another person ask you the question. You tell them to me and then they got to interpret it to me. So I really took it upon myself, at least to be able to have a basic conversation with my patients, because at that time there was a large group of Spanish speaking patients that would come into the clinic. Well, I really wanted to be able to have a conversation with you. So I got really good, not fluent in Spanish, but at least well enough to be able to ask you questions in Spanish and for you to answer it back to me. For the most part, I could understand it. Now I got the interpreter, and we had to get deep, and I'm trying to explain to you how to take your medications or what procedure we were going to do. Because once again, I want you to fully understand what's going on, allow you to be able to have that ability to be my partner. So I think that we just need to make sure our hiring practice and where we are pulling the people that we hire from. I can remember having a conversation. My daughter went to a Catholic school here in Indianapolis, and she was trying to start a Black student union. After the George Floyd incident, she didn't particularly like the non-response of her school. And she's like, we need a place. Like, people that look like me need a space. And so we were having this conversation with the principal. And so all three of my children had went to this school. And so I made the comment that how important it is for children to see people like them, and that during the several years that my children had been attending this school, that there was not one teacher that looked like them in the building. And the principal made the comment is, well, we try to hire diverse people. And so my question to her was, well, where are you pulling them from? Where are you looking for them from? You can't continue to use the same avenues or go to the same places that you always gone and think that you're going to get a different result. So you have to be intentional about where are you going to find a diverse group. So are we going to HBCUs? Are we going to, do you reach out to the Black student unions at your predominantly white institutions? Where are you holding your job fairs? Where are you posting your jobs? So that all plays into a part. So once again, health systems, health organizations, that's all important to where are you pulling your candidate pool from? And so you have to but you have to broaden your horizons in order to be intentional about truly having a diverse group of people. And it's not even just, skin color. So we need to have diversity in age. We need to have diversity in gender. We need to have diversity in cultural and ethnic backgrounds. And so it's all of that combined. And how do we intentionally do that?
Yeah, absolutely. Thank you for those nuggets. Thank you for that information. I mean, we've come a long way, but every industry, and particularly our healthcare industry, can continue to improve and move forward so that all patients feel comfortable and have the opportunity to get the best patient care they can. Thank you for being here, Dr. Stubbs, and thanks for being on this 51st episode of the Freedom Forum.
Well, thank you for having me.
Thank you again to Dr. DaWana Stubbs, and thanks to you for joining us on this 51st episode of IBJ's The Freedom Forum with Angela B. Freeman. Please come back next month for another conversation about diversity, equity, and inclusion in the Central Indiana business community.
Do you want the real scoop on what's happening in Indiana business? Check out the IBJ podcast. I'm Mason King, and each week I sit down with people who make news in Indiana to get insights and perspectives you won't hear anywhere else. It's business, but you won't need an MBA. The guests run the gamut from CEOs, developers, and sports executives to artists and chefs and financial planners. If there's a theme, it's that everything has a cost. And success often depends on how you define profit and loss. So if you want to deepen your understanding of the people and projects shaping Indiana, give the IBJ podcast a try. You can find it at ibjpodcast.com or wherever you get your podcasts.
On the go? So are we. Get the IBJ Media app, your all-in-one news source for Indiana business news. Get breaking news alerts, read every story from IBJ, Inside Indiana Business, and the Indiana Lawyer, and listen to your favorite podcasts all in one place. Big news, small screen. Search IBJ Media and download the app today.